OHJC started during COVID. We realized healthcare inequities that were really facing the minority population in our city, and so we felt like we need to do something to give them access to healthcare, give them access to preventive screenings. And the biggest thing, I think, was we had to really convince the community to trust the vaccine. That was the number one reason. And we felt like going with some institutions that were local to our community, that really cared about our community, that we could invest in that and then have them go out and do this work for us. And that's why Dr. Jeanette Berkeley-Padden from UMKC came in, along with University Health, along with Children's Mercy.
And in using that input, we came up with Our Healthy Kansas City East Side. And the way that this initiative is structured is it's basically working with 4 sectors in the community. We're working with the faith sector, the neighborhood sector, the business sector, and youth organizations.
When we turned it over to Dr. Padden and UMKC, she went out, she engaged the community, faith-based organizations, neighborhood groups, and brought all these people together, all these partners together. And they were able to have these events. Folks in the community came to these events. They were able to get hands-on screenings. I think for a lot of them, that was the first time they had an opportunity to really feel like they had some control of their healthcare.
Our research team primarily focuses on health disparities in the urban Kansas City area. We're really interested in how can we engage our community to be involved in improving health. So at the end of the day, we work really closely with our community partners to not only identify what health priorities need to be addressed, but also what implementation strategies, what tools, what information, how to tailor that information, how to package that information we can use to be able to develop programs that will be acceptable, feasible, and sustainable with our community members.
This type of cooperation with the community is important because primarily communities support each other, and it's the community that depends on itself. And that community isn't just the neighbors, it's the businesses, it's the faith-based, it's the learners, and it's tomorrow's healthcare professionals. And as a pharmacist, that's important for me to know that we're having our learners help people from diverse backgrounds, but they're also learning to work together to conquer the challenges that are in healthcare and the challenges that are just going to continue to be more complex. And if we all work together.
The Porterhouse KC, we're really excited about being able to partner with the Our Healthy Jackson County initiative. Not only because we want to make sure that our communities, we want to expand the lifespans, but also, like I said, businesses don't often get called upon to be a part of these type of community-based initiatives. And I think it's important that we are. I think we need to be a part of it. It's a whole ecosystem. We can't continue to operate in silos. We have to be able to partner and do things that are outside of our norm because you can't keep doing the same thing and expecting different results.
And with the hospital coming in and all the services, we have so many services that people that never been to the hospital come and get these services because it's where? In their neighborhood. Who's sponsoring it? Their neighborhood leaders. Who's else sponsoring it? We have a Center for Neighborhoods. Everybody knows who we are. So they know that this is a good thing.
We were able to vaccinate close to 13,000 people. And along with the community clinics, we're providing mental health services, cancer screenings, blood pressure checks, blood glucose screenings, linkage to healthcare services and community resources, along with sexually transmitted infection screenings. I mean, we're talking about almost tens of thousands of people that we've been able to impact with health services in some of the, again, most core socially vulnerable areas of Jackson County.
This collaboration relative to Faithful Response and Our Healthy Jackson County actually helps to bridge the gap that exists between the community, faith-based organizations, and universities. It's a monumental thing to have this partnership with a university such as UMKC School of Medicine. It affords us the opportunity to provide accurate, up-to-date health information to our congregants and to the communities.
I think the benefits, what you see is today. When you go out here and you see the folks coming in, they're excited about getting their healthcare needs taken care of. They don't have to go into a hospital. They've got the doctors here actually to talk to them and explain things to them about the healthcare.
We are very appreciative of the partnership. It has been a godsend for us. When you think of the potential that we have and the propensity that we have to do such a great work in our community that expands beyond the 18 churches that are participating in this particular initiative, we're grateful for Dr. Jeanette Berkeley-Patton and her team for spearheading this, for leading this, and to help provide us the resources that we need to get this done.
We want to be able to continue to see those type of community level indicators shift, see our people getting healthy, keeping our people out of emergency rooms, because if we can do preventative care, if we can do preventative health screening and have prevention programs like diabetes prevention programs, then we can begin to make a difference.